Good afternoon, everyone, and welcome. I would like to call to order the meeting. And will our executive director, Heather, do roll call?
Yes, I will. Dr. Florence Jameson. Here. Okay. Ms. Valerie Clark.
Present.
Ms. LaVon Lewis. We can't hear their mics.
Present.
Okay, thank you. Ms. Angie Wilson. Mr. Jonathan Johnson.
Present.
Mr. Jose Melendrez.
Present.
Dr. Dan Cook.
Present.
Betsy Aiello.
Present.
Commissioner Barbara Richardson.
Present.
And Debbie Reynolds. We have a quorum, Madam Chair.
Thank you so much. And if we actually get started, I just wanted to welcome Heather on our first public board meeting since she's become our new executive director, and tell us how exciting it is to have her with us. As most of you knew from our teleconference on the board, some of you may not, she is been with us for a while as our prior CFO. She is very familiar with the organization and the staff, and we just couldn't have gotten more blessed to have her accept and take on this role. Thank you so much, Heather, for being with us today and taking on the role as executive director.
Thank you. It's absolutely my pleasure.
I would like to call for any public comment. Let's start with the north. Do you have anyone up there for public comment?
No, we do not.
Down here in Las Vegas, do we have anybody for public comment? Nobody's excited to get up in front of the mic today. Having no public comment, let's go on to our first order of business, which is the approval of the minutes of September 20th, 2016 board meeting. Do I hear a motion?
Valerie Clark, I make a motion to approve.
And a second?
Second.
Thank you, Jose. All those in favor, please say aye.
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 Anyone opposed? The minutes are carried unanimously. And for our very first report from our executive director, Heather, thank you for carrying on the tradition of a written as well as a spoken report. Much appreciated. Thank you, Heather.
Thank you. Well, I think you're all going to hear a little bit more about this later in the board meeting, but we have had a very busy and fruitful off season. We were able to leverage existing grant funds and develop what I would call a successful off-season marketing and outreach campaign. The theme of that campaign was get to know the benefits of health insurance. And Penna Powers will be presenting a little bit more about this, but we've been successful in developing connections with existing consumers and also allowing us to make impressions and collect data on our underinsured and uninsured populations through this off-season campaign. As many of you know, we also had the opportunity to partner with UNLV School of Medicine and the Nevada Division of Public and Behavioral Health to integrate the Certified Application Counselor training into their community health worker training and curriculum. Between those two organizations, there will be 16 newly trained community health workers who will also be certified application counselors who are going to be out and assisting with enrollment just in time for November 1st open enrollment kickoff. We feel like the exchange is well positioned as we head into our 4th open enrollment. We've been able to build on the successes of our off-season campaign and our previous open enrollments. And it's the message of our new open enrollment, the open enrollment number 4, is it's time to get connected. Penna Powers is going to offer us more details on that in upcoming agenda items. The exchange has also seen a decline in the last several weeks in the number of brokers and agents who will be enrolling consumers in on-exchange qualified health plans for plan year 2017. This is something else we'll be discussing later in the agenda. But this decline is a result of the carriers, insurers reducing their commissions to brokers and agents for both on and off exchange plans. In order for the exchange to ensure that we have adequate resources for consumers that wish to have assistance with their enrollment and their applications, we will be using our navigators and in-person assisters along with certified application counselors statewide to assist and augment the broker to enrollment force. We are working to provide additional training and support to those organizations, navigators, IPAs, and CACs, to ensure that they're fully prepared to enroll consumers. And our marketing and outreach message is going to remain the same, which is going to drive and encourage consumers to go to our website and get information about qualified in-person assisters who will be able to enroll them. That information on our website is active right now, and we work daily to make sure that it is accurate. The exchange also values our partners with the brokers and the agents and fully recognize the difficult decisions that they're making, and we are definitely working collaboratively with all of the brokers and agents who have reached out to the exchange along with their associations. We've developed messaging for brokers who have decided to not sell on exchange this year and have asked that they direct consumers to our website to the in-person assister tool in order to find accurate enrollment assistance. Finally, I've shared with you all the public information that's now on regulation.gov, I believe it is what it's called. The exchange has submitted comments in response to the Centers for Medicare or CMS's annual proposed notice of benefit parameters, the NBPP. And I thought I would summarize some of that for you all here. This is the document or the rule that sets the fees for federally facilitated marketplaces and those that are state-based marketplaces that utilize the federal eligibility enrollment platform, which all of us know that Nevada is an SBMFP. We utilize the federal eligibility enrollment infrastructure. The exchange has commented that we noted with interest that the proposed rule indicates that there's a 3.5% that the current collected 3.5% fee for federally facilitated exchanges is not sufficient to offset the full cost of states that utilize all of the services provided by the federal exchange. We believe that this distortion of the fee is unfair to a state-based marketplace which utilizes the federal application and enrollment platform and the call center. And we believe that by artificially depressing the FFE fee, while requiring state-based marketplaces to pay the full cost of accessing its technology and call center, does not equally and fairly apply a single standard to operational cost recovery. We believe that this disparity is inappropriately benefits issuers and consumers in states that are serviced by the FFE and penalizes issuers and consumers in state-based marketplaces or SBMFP jurisdictions. We also commented in this rule there was a request for comments relating to allowing SBMFP states to pay 1.5% of premiums to access healthcare.gov technology for plan year 2018 rather than the 3% fee which was established in 2017. Given this late timing of the finalized 2018 fee, the exchange has not been given adequate and necessary time to adjust fees and operational budgets to reflect the cost of accessing the federal eligibility and enrollment system. We're asking for a 1-year extension of 1.5% and believe that this would remedy an issue this issue with our budget and allow the exchange to budget and plan accordingly. The exchange continues to believe that SBMFP should be assessed a significantly lower fee than that has been charged, or than that charged by CMS to an FFE state, because SBMFPs provide a high level of value and reduce CMS costs and workload in very core program areas. Nevada's state-based marketplace provides a level of service to our citizens that CMS, understandably, would not be able to offer. Exchange is fully prepared to fairly compensate CMS for the true market value of the services that they provide, while assuring that we're able to properly perform all of our baseline obligations. In order to retain sufficient revenues to permit us to meet our statutory duties of a state-based marketplace, which include plan management, coordination with state insurance departments, funding and overseeing the Navigator and in-person assister programs, developing and implementing outreach, education, marketing activities, financial management and oversight, annual financial and performance audits, revenue collection and reconciliation, and general administration and management of the marketplace. We believe that establishing an ongoing 1.5% fee is a more equitable assessment. I also wanted to add here that I've had several conversations over the past several weeks with CMS, and I am hopeful that the 1.5% will be extended for 2018. And I anticipate that that will be reflected when the rule is finalized. The CMS is unwilling to give me a timeline of when they believe the rule will be finalized, but we all are in agreement that it would make sense for the rule to be finalized prior to the next administration taking office, which would be in January. So hoping that we'll have some indication on that potentially in December or before January. We're also continuing to explore the long-term sustainability of remaining in SBMFP while also exploring and looking into private and proven technology. And that is, I'll say what Bruce said, the sum and substance of my report.
You listened well and were taught well. Bruce was just outstanding executive director. I would like to thank you for that report. Extremely thorough, very comprehensive. For questions and comments. And I would like to just preface the fact that or discussions that may center around changes for reimbursement of brokers that we'll actually be addressing a little bit later in exchange enrollment partnership on our agenda. So although apps on this report are fair play at this point, I think that when we get to the part, and we're going to have our insurance commissioner, Barbara Richardson, speak to us on some of the changes that have occurred with reimbursement by our insurance carriers to our brokers, that let's save most of those questions for that portion. And having said that, is there any other questions or comments on Heather's report by any of our members?
Madam Chair, Valerie Clark. Is she talking? I think it's me. Yeah. I just have a question because we have reviewed a lot of private technology in anticipation of hopefully being able to have the exchange go back to state-based private and proven technology. I'm hoping that we can still very actively pursue that. I felt so relieved at the information that we would be able to glean and the way we'd be able to operate, whether it was a broker or any individual that was helping someone on the exchange. That the private technology that we looked at was so, just looked so incredible. And from what I understand, the pricing was comparable to what we were paying or potentially would be paying with the feds. I hope we're actively still pursuing that and have plans to go that route. I just see so much more positives for the entire state as a whole if we could get to that endpoint, and wonder just where we are with that.
Valerie, thank you so much for bringing that up, because all of your points are right on. Indeed, the programs that we reviewed, such as the one used by Idaho, are such superior platforms to the federal platform that we're currently using. Much more robust services. And in addition, as we love to say in medicine, when we talk about quality medical care being provided, cost-effective, quality, with regard to the technology, also, besides being excellent programs, the cost would not be not only comparable, as you mentioned, but far better a cost than what we would be expected to pay on the federal hub. It would be so much more because, as we not uncommonly see in private enterprise, capitalism and competition, we would be getting a far better product at a much lower price. So all your points are extremely well taken. And I want you to know, as I'm going to allow Heather to share with you in a moment any other comments on this, that as you saw, many states started off with other companies other than Xerox, as we did, approximately 13, and I could be corrected on the exact number, and did very well. And so it is possible to exist off the federal hub. And it is absolutely our vision that we will go ahead and get off the federal hub and turn back to a private program that is a tried and true, proven, and far superior program at a better cost. Right now, there are several issues that have to be vetted out, which our executive director can share with you. One big one is the CMS does have to give us permission to leave the hub, and that's being negotiated. In addition, our own state officials, such as the governor, who went through quite a bit of hard times defending, embracing this entire program. As you know, First Republican
Your mic went off. Just a second, Dr. Jameson.
testing.
Yes, it works.
So, as you recall, it was a very agonizing experience for everyone, particularly the residents of Nevada who wanted to use the exchange when we were on the Xerox program. It was extremely difficult for the clients, and the brokers were literally stonewalled. And it was such an unbelievably difficult time, and for the board, who was trying to establish a good working exchange, and for the governor, who put himself out there to embrace the Affordable Care Act, both the expansion of Medicaid and our state exchange. So we are going to need to show that we have a product that is proven, and we're going to need to do some more work before we probably move ahead on that. And I'm going to go ahead at that and tell you we have absolutely not left sight of that vision. And we think it will be the optimal way, as we have shown, because in the past, what we have shown is that compared to most states, because even though we went back to the federal hub, we maintained local consumer outreach and education, which enabled us to get better results than virtually any other states in getting people signed up for our qualified health plans. And so we want to offer the best possible programs. And so we are looking at that because we think it's the only way, Valerie. So thanks for bringing it up. Heather, did you want to add anything else?
I would just concur that agree that there are definitely conversations happening in every way, shape, and form to position us to a place where we will be able to transition to a private platform. There are all sorts of policies and challenges that need to be worked through with our collaboration with CMS so that ultimately they will approve of a transition. But that is certainly something that we are spending a lot of time focusing on.
Thank you so much for those comments. I would just be curious, is there some sort of a deadline or a timeline that we're working on that gives us an idea of how long this process will take?
I'm going to defer that question again to Heather because she's working on the timeline.
Thank you, Madam Chair. We are hoping that we will get our 1.5% for an additional year for plan year 18, and that we could start the process of engaging a new vendor potentially sometime in January or February of this year so that we could be fully transitioned by plan year 2019.
Thank you very much.
Some of the really, as you recall, Valerie, excellent programs that we looked at, they felt very confident that they could get up and running with about a 6-month time frame. Okay, so my general comment is I just first off, looking at and listening to the report, wanted to once again say over the last 2 years and last year that it was 104% of our prior year's enrollment, 30% higher than our enrollment in force. And I just wanted to say bravo and kudos to our incredible Silver State Exchange for their outstanding work with partners of Pana Powers and the Ramirez Group and the navigators and our brokers that really last year were such a major part of the enrollment. So I just want to say great job, everybody. And although I know we're going to be going into this new year with some real paradigm changes, major changes, this again will be something that we'll discuss it as it comes up in other parts of our agenda. So I just wanted to say that I couldn't be more grateful for the successful 2 years we have, and that even though there are some sort of unexpected and daunting challenges in front of us, I still remain confident as Heather and extremely optimistic that the exchange will not be going away and that we're going to become and maintain being a very valuable and integral part of our healthcare system for those vulnerable citizens in our community. Marketplace update.
Thank you, Madam Chair. Janelle Davis, Communications Officer for the record, and pardon my allergies, but just bear with me. As Heather stated, our off-season marketing campaign took place from March 2016 to October 2016, and we will seg to our 4th open enrollment to kick off at the end of this month. The campaign's theme was Get to Know the Benefits of Health Insurance. Our objectives were to institutionalize the exchange, identify and target the uninsured populations throughout Nevada, and use social media, digital advertising, and outdoor advertising to educate our target audience about the need for health insurance. We maintained awareness through an outdoor advertising campaign as well as a strong digital advertising presence. We created an email capture campaign where 1,632 consumers opted in to receive health insurance information and health tips related to our blog, which is now on our website. We will be sending emails to this list of consumers referencing upcoming important dates and deadlines related to open enrollment. Nevada HealthLink also expanded their outreach presence by attending more events than in years past. We researched multiple events with our target demographics, which consist of, but is not limited to, the tribes, rural Nevada, the Hispanic Latino population, young millennials, the 50-plus community, the self-employed, and other ethnicities. We have attended 89 events through September of this year. New outreach and educational materials such as literature, have been printed to engage our audiences and provide a clear understanding of how to enroll in a health insurance plan and how to receive in-person assistance, with an emphasis on why it is important to be covered. The off-season campaign has been a success for the exchange and has helped us to realize the importance of having a year-round presence with the public and our potential consumers. For Open Enrollment 4, as you know, it begins November 1st and goes through January 31st of 2017. This will be our 4th open enrollment and our 3rd enrollment using the federal platform healthcare.gov for eligibility and enrollment purposes. Our theme for this open enrollment is "It's time to get connected." We will continue to focus on the millennial population, families and individuals, the 50-plus, self-employed, rural and tribal areas, and Hispanic and Latino populations, as well as other ethnicities. Our media campaign will include content marketing, which is comprised of all forms of social media, with new additions of Snapchat, BuzzFeed, and online video advertising. We will also have a traditional and robust advertising presence, including television, radio, PR, website updates, and ongoing email communications that will kick off the week of October 24th and run through open enrollment. TV advertising will be, of course, after the election. Patty Hallebuck from Penna Powers will review the creative concepts that we have developed for our open enrollment marketing campaign with you. Nevada Health Link, in conjunction with our vendors and contractors, will continue to be present at community events statewide. We will also be hosting our kickoff event, which is Tuesday, November 1st, from 3 p.m. to 8 p.m., and that will be in Reno at the Peppermill and in Las Vegas at the Cashman Center. More information about these events can be found on our webpage and have been sent to our navigators and broker community. The exchange has been actively working on stakeholder initiatives. It is important to leverage our relationships within the healthcare community and provide resources to see how we can collaborate and synthesize our mutual efforts to reach our target populations. We have developed an email blast, a PowerPoint presentation, and a fact sheet for our stakeholders to use as they see fit. The exchange and our partners have been working diligently in an effort to make this our best open enrollment yet. I'd like to turn it over to Patty Hallebuck, who will present our creative concepts for this marketing campaign.
Thank you.
Good afternoon, everybody. I'll take it over from Janelle. That was quite comprehensive. Thank you. You did a lot of the work for me. So everybody should have the marketing update deck in front of them, and I will just kind of piggyback on what Janelle has said and walk through some of the additional highlights for you. You summed up the off-season campaign quite well, Janelle. Just reminding everybody that our outreach team with Ramirez Group was very busy during the off-season, attending 89 events. That was a core component of our off-season, and we were thrilled. In addition to the events, we were really able to zero in on some of our specific target areas. You can see some of the numbers here. So it was quite an additional volume this year versus last year. On page 3, you can see a little bit fuzzy, but some of the actual billboards that were up around town, as Janelle mentioned, in the campaign. And we were able to garner almost 99 million impressions, and that is the number of times the campaign has been viewed. So that's statewide. So we're pretty enthusiastic about that. And as Janelle said, that just creates awareness in the off season as well, which is an important component of what we're trying to achieve here. Social media and content marketing, as Janelle said, had played quite a large role in last open enrollment, so we continued that on through this off-season, and we'll continue into next open enrollment as well. One of the things that we really like about social media and content marketing is the ability to target specific areas statewide, and in doing so, the cost per click becomes very, very economical for us, so it's a great way to reach our target audiences. I'm skipping to page 7, just a mention of PR in the off-season. PR was pretty quiet, so you can just kind of see here some of the various things that we promoted in the off season. We were able to last open enrollment garner quite a bit of media PR evaluation, and so we're gearing up to be able to do that this year as well. We'll get to that. One of the things I wanted to touch on page 8 was our Stakeholder Initiative. This year, what we did in the off season, in addition to the marketing campaign, we really collaborated with all of our resources, Ramirez Group, the Exchange, Penn Powers, and some of our other PR resources to create a database and identify relevant statewide entities who have agreed to advocate and educate to their groups on behalf of Nevada HealthLink. So you can see here the list of stakeholders that are confirmed. We are continuing to grow this effort as we move forward. So this has been a great opportunity to establish another avenue for marketing outreach for us. We also have engaged in a couple of marketing partnerships, sponsorships. We've talked about Art Tone. In addition to that, we have engaged with UNR and UNLV in a sports capacity in terms of football and basketball at UNLV. What this allows in these sponsorships is multiple branding opportunities to their very large and diverse audiences that range in age from basically 18 to 65, which is huge for us. These partnerships also include outreach tabling at each of their games, radio interviews, UNR game sponsorship sponsored by the Nevada HealthLink, social media coverage, and also a sponsorship of a UNR game contest online where the winner gets to attend the UNR-UNLV game here in Las Vegas on the 26th. So in addition to great exposure, it's great outreach opportunity to a diverse audience as well. So we're excited about that. Moving on to open enrollment. We have here on page 10 some representative, creative, and our messaging. As mentioned, the message is going to be, it's time to get connected. This segues from our off-season campaign. So we are targeting on our millennial audience, our 50-plus audience, and our families. And we have created creative in multiple ethnicities. So this is just some representative here, but we have other kind of groups of creative as well. So just want to give you a feel for what you'll be seeing in the upcoming few weeks as we transition into open enrollment. Page 11 is a more comprehensive overview of what Janelle mentioned. This is the advertising component-wise, what we'll be using for the marketing campaign. As Janelle mentioned, TV will start after the election. We will be using radio, print, outdoor, as well as direct mail. One of the things I wanted to mention with TV and radio was that we will be using that on a much broader scale this year, and in doing so, that will allow us to ensure a significant reach into the rural areas around the state as well. I should mention as well that print is going to be targeted to specific ethnicities. In addition to the general market, we'll be focusing on the Hispanic market, the Asian market, and the African American market with specific publications for print as well. On page 12, Janelle mentioned our content marketing. We'll be using content marketing and social media again this year. Also, I failed to mention, you can see the market allocation is 75% in the south and about 25% in the north. That will be for overall for the advertising campaign. Yes, sir. On page 13, you can just see a grid here of our TV placement, our specific stations we're partnering with, both in the north and the south, the dates when the advertising component will initiate, and the weeks that they'll be running throughout the campaign. And again, on page 14, outreach continues to play a huge component for this campaign. We have 63 events currently planned from October through the end of January, focusing in wherever we can on specific targeted events. And that event list is ever changing. It's fluid. We're all researching and mining for new and better events to add to this list. So you may see this grow. So outreach is a huge component. We're making great strides there, and we will continue to do so throughout enrollment. On page 15, you can see the comprehensive PR relations plan. Again, lots of value add, lots of opportunities to create for both Janelle and Heather to be on the morning shows and lifestyle shows and get some airtime to be able to talk about the exchange. And lastly, as Janelle mentioned, there's also been a lot of updates and additional components added to the website during the off season. We've added more articles to our quote-unquote blog page. This is a page of helpful articles, health tips, and other knowledge that people can go to year-wise to get help and just get in the know. We've improved the search parameters, improved the language assistance display, and the search area adjustment tool. So all those components are now in play, and we're ready to go for open enrollment. We will also update the creative on the website to match the new creative for the advertising campaign, so it's a smooth transition when people see advertising and go on to NevadaHealthLink.com. Thank you.
Thank you for that very comprehensive review. Do we have any questions for our marketing team or comments? Jose?
Jose Melendez for the record. So, I like where the focus is going, given my concern, and I shared this with Heather when we spoke about this, my concern being that, given the population count in the South, knowing where the demographics tell us where the people are, making sure that we're putting the outreach efforts into the areas where we know those populations are. And I know when we did the recent program with the Southern Nevada Health District, and they showed us the mapping activity of where things were missing, things weren't happening, and that the exchange could have a real impact in that sense of making sure where the resources are, that we're putting them in those right places to address where the demographics are, so that we're equitably reaching out to those populations and making sure that we're hitting as many as possible to get them enrolled and all. And yes, we've knocked down some of the numbers in terms of with the Latino population, with other communities of color, but we know there's still a lot of work that needs to be done in those areas to enroll them and get them into the insurance process and that they have access to the exchange. So I definitely, in my role, I'm going to be looking at that and wanting to focus on that. So, as the staff, Heather's your staff and the team really thinks about where we need to be putting these resources, that we're really looking at those areas and making sure. And I know I'd like to, Andres, would you come up and maybe comment a little bit about some of those areas where some of these things can be, as your thoughts at some of the Hispanic outreach and some of the other outreach, are we in the right places? Are there more things that we could be doing, should be doing? Sorry to put you on the spot like that, but.
Andres Ramirez for the record. Madam Chair, Chairman Melendez. You can see from Janelle's summary and from Patty's report as well that the overall outreach has definitely increased. We have more than doubled the number of events that we've done since this point that we can compare it to the years past. So the level of activity has definitely increased substantially. Part of that has been from Janelle's leadership to demand and make sure that we're attending more events, and from the collaboration with Penna Powers to ensure that there's a system in place that we're getting to these. And we have navigators who are attending events as well, so that certainly helps make sure that we're reaching more populations. From a strategic process, there are still a lot that needs to be done. The Hispanic community is still one of the largest percentage of uninsured populations in Nevada. So even though we've reduced that uninsured significantly over the past 3 years, they are still the largest component of uninsured in Nevada. So there are some additional things that we can look at to reach, try and find a way to communicate with the Latino community more effectively to help reach that. We have some additional events proposed that can help with that. I'm not sure that there are enough events yet currently targeting Latino communities, but that is, as Patty said, an ongoing process and a fluid process for us to continue to reevaluate and research what makes sense for us to attend.
Thank you. Thank you so much. What I would add to that is, of course, Jose, I think that your work you're doing with the community health workers is right on the point to this issue, because the whole concept of them in communities throughout America is that they will now make. Hello? Hello? Hello?
We can barely hear you. Just a second. Looks like we're. Oh, yeah, good idea.
As we've discussed in the past, we've been fortunate with the programs and events we've had, as the saying goes, to shake sort of the low-lying fruit. But we know that in order to dig deeper, we've got to go deeper. And as Jose is aware of more than anyone, with the community health workers, they're kind of our new secret ammunition here, that we're going to dig deep and get really into the communities deeper that really need it. And these community health workers will hopefully find some of those people that need this that we haven't been able to reach. So Jose, I applaud you and your work that you're doing in the community health program, because this is going to take us deeper to reach these people that so far some of our programs, events, and community outreach education have not. But I have to just applaud everyone, because I just think we are doing an amazing job with some of the best statistics in America. Was there any other questions?
Yes, Levon Lewis for the record. I have one question. On page 14, you identify events, and you have 1 tribal event, 3 Hispanic events, 3 ethnic events. What's an ethnic event?
Events that primarily focus on other ethnicities, for example, excuse me, I apologize. For example, Culture Fest, which is more African American related event. We have an Asian event as well. There's Filipino events, just other ethnicities in general. We're kind of lumping those into the category of one ethnicity, if you will.
Well, I would like to reiterate what Jose has already said about enrolling African Americans. I think we have a fairly low enrollment of African Americans, many of whom qualify for the health plans that we offer, and because many of them are part-time workers who really don't have coverage anyplace else. So I would suggest that we look to do to increase our marketing into those areas. And I can just recommend a whole bunch of people for you to work at the Salvation Army. Yeah.
We would really welcome those recommendations of individuals and entities, organizations where future events could be held to reach out to that population, Levon, so you two get connected.
Just real quick, Jose, I just also want to thank Heather, because I know she reached out to me, and she's going to be down here early November, and she's asked me to help set up some meetings with folks and community folks about this. And so we're going to be having. I'm going to try to fill her calendar on that morning and get to some folks in front of her that can share their stories and also give us some advice and input into areas that we haven't thought about. And so again, I want to thank Heather for making that possible when she's down here, and we're going to meet with the whole series of folks. And so anybody here who needs to be there, I think Heather, it would be all right for them to join us, correct?
Yeah, absolutely. The more the merrier.
Madam Chair, the last comment I would like to make, just Andres Ramirez for the record. Ms. Lewis, Commissioner Lewis, as you mentioned, we work for you. So if there's a specific event you feel we need to be at that you just haven't seen we're at, please just let us know. Send it to Patty, send it to Janelle. We'll make sure it gets booked. We're doing our best to find events, look for events, reach out to partners, see what they recommend. But obviously you have expertise in your community as well. So does Commissioner Melendrez. So if there's a specific event you feel we need to be at, just, send Heather or Janelle an email, and, we'll make sure we get there.
Thank you. And thank you for the excellent report representing outstanding work that you are doing and the desire to do more. Thank you. I would like to go on to item number 6, the Exchange Enrollment Partnership. For this part, I would like to start the discussion, have Heather start our discussion. Heather, could you go ahead and start that? Then I imagine we'll be hearing here from Barbara Richardson. Thank you.
Yes. So thank you. And just to reiterate some of the parts of my executive director report, the exchange, we have seen a significant decline in the number of brokers and agents who are interested in selling on exchange policy for plan year 17. And we know that that is a result of our insurance carriers reducing the commissions that they'll be paying both for on and off exchange products. We, in plan year 2016, last open enrollment saw close to 500 brokers who were engaged in selling on exchange. And this year we are showing a little under 100. So we are constantly reaching out to our broker and agent communities to affirm and try to determine who will be actually engaged in selling on exchange product, and have had to open up the resources for consumers to make sure that we engage our navigators and our in-person assisters along with those CACs across the state to make sure that there are enough resources for enrollment. We are working collaboratively with our broker and producer community along with associations and working with the Division of Insurance, and would really like to just hand over the microphone to Commissioner Richardson and to the board for any other questions.
Thank you. I appreciate it. Can everybody hear me? Okay. So I just wanted to make a couple of comments, and then mostly I want to open it up to questions. In the first instance, I want to let folks know that the division itself is working on market stability, and that's really what our focus is, trying to make sure that there's enough products, make sure there's enough carriers, make sure that the actual products that are being offered are compliant and also diverse enough that people have choices in the marketplace. That is one of the things that we really focused on. We did see pushback from the carriers at one point when they changed their commissions rates, and that's just one of the things that they've been thinking about doing, and that's based on trying to get their expenses down. Really, this is what's driving what's going on, and because there is a pushback from the department trying to keep the carriers from raising their rates so high that the consumers are harmed. So that's, there's that push and pull that goes on all the time. We are continuing to work with the carriers. They are giving us a call when they think about making different changes, and we talk back and forth to them about whether or not we think that might affect how that might be steering or not steering folks in the marketplace, because that's one of our concerns. We don't want to see a lot of shift. We're looking for a stable market here in Nevada. The other thing that we're doing to support what the exchange is doing itself is we are targeting our public resources or our education resources towards trying to educate those consumers who are auto-enrolling, because there's a huge bulk of consumers who are actually automatically going to be put into the same position that they were in the past. And what we're trying to do is encourage them to go and shop, because that might not be the best program for them. That might not be the most cost-effective program for them. So we're really trying to spend our time focusing on that. And I think that works hand in hand with what the exchange is trying to do. One of the things that we have done also is we'll be altering our website to show not only those products that are being actively marketed, but also are available. So it lets the consumers look at what they have now and what they could have. And it's just one more avenue of trying to engage that consumer base in understanding what they're trying to do for their families, because that's what this is really all about, is getting them the product they need for themselves and their family that best fits their needs. But really, I wanted to make sure I was here in case you guys had any specific questions about what's going on. I think Heather and the chair basically already addressed the fact that we are seeing a decrease in the brokers across the board from all the carriers. So I open up for any questions if anybody has any.
Were there any questions from our members for the the insurance commissioner regarding perhaps if any of you still don't understand what factors were contributing to the attrition of the brokers, which we worked so hard to build over the last couple of years? Did anyone have Valerie, please.
Well, Valerie Clark for the record. I just wanted to thank the commissioner for all of her help. I know our associations have reached out for clarification and answers, and I don't really have any questions about it. I just wanted to publicly state that the broker community is, we're very loyal to our clients and the consumers that are out there. And this came rather suddenly. It hit us quite quickly right before open enrollment. And so those of us who do primarily individual products to support, as a career, as a profession, I don't necessarily do that much individual, but I know there's a lot of brokers out there that do. This really throws them for a loop because it's basically how they feed their families, and it was a very, very drastic cut. And there are those carriers that have come out and agreed very recently to continue to pay commissions better than some of the other carriers that are on the market right now. But we're just, as a whole, as an industry, we're really grappling with how to stay loyal to our clients, how to help our clients and still be able to survive. So, I just wanted to make that statement so that people know that we're doing our very, very best to help in this very tumultuous time. And I just wanted to thank the commissioner for her assistance, and also Heather. It's been a crazy time for all of us. So thank you.
Thank you so much, Valerie, for appreciating that. And I would like to say thank you and your other agents, brokers who are staying in there to service the client. That's what it's all about. And hopefully, I know there were cuts. I understand they may be dramatic. Hopefully, by the end of the year, when we do see whatever the calculations are complicated, what your reimbursements end up being monthly, hopefully they may not be as bad as we suspect, we hope. And I think one of the main reasons that, of course, we had our insurance commissioner here today was to share that exactly that there still will be some reimbursement for the brokers, certainly not what they'd expected in the past. I think there were some rumors that there would be no more reimbursements. If the insurance commissioner, Barbara Richardson, you would want to kind of clarify, I know it's a complicated formula, but maybe in a simplistic way, share what they had and what they'll be going to, just for FYI, the people on the board and the general public.
And honestly, I wish I could, but the carriers haven't settled yet. We're still negotiating with them to make sure that everybody's trying to reach their mark. So I apologize, I don't have an answer right now.
Well, very good. You know what? That brings us, I think there are no more comments. Oh, one more comment.
So I guess just for us to be thinking about, obviously, if this doesn't get settled in a way that works with the brokers, and then we're left being dependent on just navigators, if I understand that correctly, is there what's our backup plan if we have to start looking at more of the other side being trained or being brought on board? Heather, can you give us a little insight into that?
Yes, that's certainly something
Heather,
that's on my mind.
Thank you so much. Yes, Heather, actually, too, in the executive report, started off by sharing with us the increased number of enrollment assisters. And Heather, if you would, go ahead and address that.
Sure. Yes, that's certainly something that we are looking into deeply and trying to, as we build our budget and get budget items approved, thinking about how we can support in increase consumer enrollment, whether that's through an expansion of our Navigator dollars and or offering and looking into potential options for working with brokers and agents. And through, other states have got good models of how they incentivize that community to work with them. So that's something we'll be looking at in the near future and over the next year.
Thank you, Heather. So we're moving along to discussion and possible actions regarding dates, times, and agenda items, and then just going off from what Insurance Commissioner just shared with us, I would like to suggest that perhaps by our next meeting, the Commissioner could give us some follow-up on if it's completed out of negotiations, the follow-up on the broker reimbursement issue. There are several other things that I would like to see come back, but I'm going to go ahead and let the board mention what they might like to see on our next agenda. Does the board have any other comments about what they would like to see for possible action regarding or other items, agenda items in the future meeting?
Jose, for the record. So just for future meetings, as we continue this work and looking at the distribution of the resources and how we're serving both sides of the state, if it's a great start what was shared with us today. So as we start to put more definition to the plan, that's we are able to see that and continue seeing how that's going to move forward and how those resources are going to be distributed in order to serve the North and the South. I appreciate that. Thank you.
Madam Chair.
Valerie or anyone up north, did you have any particular things you want to be sure are on the agenda? Valerie.
Valerie Clark for the record. I think it would probably be good just to have an update on, since open enrollment is starting in a few weeks, we should probably have a good update on the activity that we're seeing in the board meetings throughout open enrollment. Calls, issues that we're having, anything that would, that we would need to, any information that would help us make good decisions. I think we just want to get updates on that throughout open enrollment.
So an update on open enrollment, how it's going, positives and negatives. And then again, the always update from CMS or any of the other entities that would have a bearing on our transition from the federal platform to a local platform again. I'd always like to have any update if there is one next time. I think that might perhaps conclude it. I don't see any other hands that are up. I want to thank our Insurance Commissioner, Barbara Richardson, for joining us this time and also extend an invitation in the future at our regular meetings. Was there anyone else that had any comments before we go to public comment? Seeing no hands. Is there any public comment up north?
There is none.
Do we have any public comment down here in Las Vegas? We have someone.
That mic isn't working. We can't hear her. I'm sorry. Can you give her a different microphone? We need to figure this issue out.
Adele Solomon, Southern Nevada Health District. So I had a few questions about the event response rate, and that was how many people sign up, how many people make contact, and they have positive results from the events. And I was wondering if that could be broken down by rural, ethnicity, Hispanic and African American and Asian, and millennials. I think that's important data. I was also wondering, the last data I saw was from last year for our uninsured rates, which was what, 70.6 and 99.3, I think, for adults and children. And I'm wondering, are we on target? I know our goal is 100% by 2020. So did this last enrollment meet that target? And if not, how far we were off from that? Another thing I've noticed, and this is just a personal observation, my husband and I this past summer happened to hit like every county fair in the state. It was kind of weird. And one of the events I saw was up in Lincoln County where they had a rodeo, and everybody in the rodeo was owned many, many horses. So they had trailers, they had very fancy trucks, they had very fancy trailers, and I saw Nevada Health Link there. And when we were driving into the town and we were driving out of the town, extremely poor neighborhoods, but those people were not at the fair. It was truly the rodeo people that owned the horses. So I'm wondering if we can look at the response rate, if we are hitting the people we need to hit where we're going. And is this the proper messaging? Because, you know, if I go to fairs and stuff with my kids, they're pretty much yanking on me for the ice cream, and I'm not going to stop and listen. And I'm wondering if maybe in those zip codes, for depending on who they are, if we could mobilize the Mercaditos there for the Hispanic populations in those particular areas, or maybe with the African Americans, maybe we could mobilize going into the parishes and talking through those. We do have the demographics on the zip codes and who lives there, and I think we could use that. Also with the Indian Health Services, I know that's a huge culture change to move them from Indian Health Services to get the supplemental private insurance. And so are we doing special messaging for them, because it's not business as usual for them where you just go and say, here's an advertisement of why you need it. I don't mean to be critical. I know everyone's working very, very, very hard, but I'm also learning that getting the specifics in the data and knowing specific goals and where your wins are and where you're falling short and doing quality improvement activities there really makes a huge difference. And I want you guys to be on target. You are featured, obviously, in our Community Health Improvement Plan, and we'll fully support your work. So if you need our assistance to help mobilize certain resources, we'll be happy to do that. Thank you.
Adele, thank you so much. Your comments are extremely appreciated. As you probably know from public comment, that we actually don't answer any questions during public comment. However, we will indeed put you in touch with our Penna Powers, our marketing team, and reassure you that much of what you discussed, they're all over. But in addition, I think as we heard earlier, there is a lot, I'm sure, other places they can target, and it sounds like you've got some really great ideas. And with regards to the statistics, we have in the past asked our team to let us know what they felt attendance and the how many people they did sign up at various events, and that was data they were planning on getting back to us with. So stay tuned, and we will try to have some of that valuable information available for you in the future. Did we cover everything that you brought up? Okay. All righty. No other public comment? Okay, I'll entertain an adjournment. Okay, second it?
Second.
Okay, then we will go ahead and adjourn. Thank you, everybody, for attending.
Thank you, Madam Chair.